a guest who hasn't been with us for a while. We're delighted to have him back, Dr. Kevin Kavanagh. Good morning, Kevin.
Oh, good morning, sir.
You look great, man. I guess life is treating you okay.
Well, getting along.
Good. You started an organization how many years ago?
Oh, I bet it's close to 12, 13 years ago.
Health Watch
USA.
USA. Tell us about it.
Yeah, it's a nonprofit organization. We have about 15 to 20 very active members, many of whom are professionals, PhDs, doctors, nurses, that have been harmed by medical care, adverse events, and are very concerned about patient safety and also about the cost of medical care that we receive.
Good. That's a good thing. This morning we're going to talk about the number one cause of death for people under age 50.
Yes.
Tell us what it is.
And that's opioids.
That's amazing, Kevin.
Well, I know. And I wish I had a TV camera here to show the audience, but I can show you, Jack.
The growth
is just unbelievable.
It's a line that goes from the bottom all the way up to the top.
It starts flat in 1980, and now it's almost vertical. It is continuing to grow. In 2017, 47,600 overdose deaths. In Kentucky, between 2016 and 17, there was an 11% increase in deaths. 130 people die each day in the United States, and it just keeps on going. If it's left unchecked, by 2025, there'll be a 147% increase in opioid deaths compared to 2015, totaling over 700,000 individuals. This is just terrible. And the way that it started is just reprehensible. It is a story which I think is worse than the tobacco story. And it's leading now to similar events of states suing Big Pharma, led, I think, by the state of Massachusetts last week, which has just filed their first formal complaint. And so there's been a lot of publicity on this.
What do you mean how it started? Well, how did it start?
Well, a lot of it started on good attempts of doctors trying to relieve pain, but it was misinformation. 80% heroin can trace this back to prescription opioids.
80%?
80%. And a lot of this is linked to also marketing by Big Pharma. For example, between 2013 to 2015, there were over 434,000 payments totaling almost $40 million, which was given to physicians. And
to get them to prescribe their meds?
Teach them about medicines. That's certainly what I think the intent was.
Okay.
And recently, in JAMA Network Open on January 18th, published a story which showed a marked association between pharmaceutical marketing to doctors and money spent per county and the number of opioid deaths. So gifts to doctors do make a difference, especially when they're of a high amount. They do change behavior. A lot of times the doctors don't think that. But this all led to overprescribing of opioids, along with, I think, a distortion of the basic science on whether or not they were effective. Many physicians were told that, these are not addictive if given for chronic pain.
Right.
And if you look at where this came from, it came from a single letter which was published in New England Journal of Medicine in 1980. It was unsubstantiated, not good research, and that's what the whole basis, everything could be traced back to. And there was a very good article on that, which was again published in New England Journal of Medicine, trying to trace back where this information came from and how it was based. So opioids for chronic pain used to be thought to be not addictive. It's now known that's not the case. And you can't predict who's going to become addicted and who's not. And unfortunately, most are going to develop a tolerance to opioids. Most.
Hey, that's scary.
And when you look at the overall effectiveness of opioids, they are not that effective, minimally effective in relieving chronic pain. A recent study that looked at all the literature, this is called a meta-analysis, it was published in December, also in JAMA, looked at all the literature and summarized the studies, and they found minimal effectiveness for relieving chronic pain and no advantage in relieving pain over non-steroidal anti-inflammatory agents like aspirin. No advantage, but a ton of disadvantages. And when you look at then the downside of the addiction, the dependency, etc., it is just not worth prescribing this drug for chronic pain.
Let me read you a text that we just received, and then we're going to take a break. Get your reaction, then we'll take a break.
Yeah.
This one says, I am 54 years old, and I can count 16 of my friends that I grew up with that have died from opioids. 54. I'm also a recovering addict, and I thank God every day for the strength to recover from this. But it said there were some very talented people in that group that I grew up with. Most of them were employed and got hooked through injuries. He just said he reinforced exactly what you just said.
Yeah, and if you go the route of non-steroidals, you may have a little bit more pain in the beginning, but long term, you're going to do better. Your body's going to kick on natural endorphins.
Here we are. Dr. Kevin Kavanagh is with us. We're talking about opioid, talking about as serious a subject as there is out there today. Yes. And I want to just repeat what we said at the beginning. Number one cause of death for people under age 50, opioids. That blows me away.
That's correct.
Okay, here's a text. I have had 3 back surgeries, and the pain pills did their job for 12 weeks at a time. When I stopped taking them, I was grumpy. I never even thought of taking heroin. So it made him grumpy, but I guess he's one of the lucky ones that was able to stop.
Well, and that's true, but you have to ask yourselves, if you were on non-steroidal anti-inflammatory agents, would he not be having the risk, and would his pain actually not be as bad?
Yeah.
Because opioids change the neuroreceptors in your brain. It makes you more susceptible to pain when you're not taking them. It affects your pain tolerance, so there's no reason to take them. And one of the things that really got me when I read through the allegations in the Massachusetts lawsuit was that in 2014, Big Pharma was making plans on how to market drugs to get people off of opioids because they were addictive. And at the same time, what was going on in the medical community is they were being visited by individuals telling them this isn't addictive. Let alone they were being taught this in schools. I mean, it was thoroughly from the journals who were publishing these articles. I mean, I think you could point a finger even at New England Journal of Medicine for not correcting that letter for such a long time. Mm-hmm. To medical schools and curriculi, to doctors that were hearing this. It was just everywhere. And so, they actually believed, along with patients, these were a good thing. And this is how we got in this huge mess. Some of the statements in this complaint, and I'll just read one. A staff wrote, "It is an attractive market, large unmet need for vulnerable, underserved, stigmatized patient population suffering from substance abuse, dependence, and addiction." This was 2014. Denotation was from a slide presentation. Another statement. Staff assures Kathy that children were overdosing on pills, not films, which is positive for Tango. Tango was the code word.
I was going to say Project Tango.
Tango, yeah, that was the code word. Now, it was never enacted, apparently, but they were considering to try to develop or market, and this is what is alleged now, develop a market to get people off of these drugs, which the doctors at that time felt weren't addictive. And I can tell you it even affected the federal government. You could talk to Hal Rogers, who at the time was trying to get the FDA to reclassify OxyContin as a dangerous drug, and he just met with roadblock after roadblock.
Big Pharma is very powerful.
Well, yeah,
right?
And we had some evidence of that even on this radio show, and we talked about the meth epidemic, trying to look at Sudafed and sales of those types of products, the type of blowback that we had.
Ron, good morning.
Good morning, Jack. One thing a lot of people don't realize is that the pharmaceutical companies are given a quota of how many Schedule II narcotics they can produce. And in Congress, there's been a real strong push to lower those quotas, but the pharmaceutical lobby is the biggest lobbying group out there, and they are pushing back hard.
Interesting.
It'd be very easy, just reduce the quotas that these companies can produce.
But what's going to happen is they're going to go those who are deeply addicted are going to go to heroin. right?
Oh, yeah, they're going to flip back and forth.
Right.
If you get rid of the fentanyl and the heroin coming from Mexico, they're going to flip over. You're going to see the pill mills pop up again.
Yeah.
And then when they shut down the pill mills, people are going to flip back over to heroin.
Yeah. It's a never-ending cycle. I appreciate your call. Thank you.
Well, I think that is somewhat true, but we need to remember that 80% of people on heroin started with this pharmaceutical debacle. And so I don't think we should be shifting the blame on the patients or the addicts.
Okay.
I mean, let's face it, physicians are well educated, they are well trained, they go to school a long time, and we do this to try to safeguard this from happening. Yes, it's very understandable how it happened, but physicians aren't entirely blameless. What we need to do is to pick ourselves up and say, hey, look, we've got to get out of this mess and help the people to get out of it.
5 minutes left. What's our takeaway from this get-together?
Well, the takeaway is do not take opioids unless you absolutely have to take them for acute pain or cancerous pain.
What if the doctor prescribes them? Just tell
Well,
them
you don't
no?
have to take them. You know, tell them no. I want to try non-pain management, physical therapy, antisteroidals. Sometimes in the beginning you'll have to put up with some pain in order to maximize your chances of recovery. I honestly feel you will recover better without taking the medications. And I'm speaking from being a person who has chronic pain, as you know, Jack. I've had 3 neck operations. I have gout, other forms of arthritis, and I do not take opioids. And I can tell you the endorphins will kick in. They will make you sometimes a little tired, but it's better than being gorked out of opioids with risks of death.
From the physician standpoint, aren't pain meds a little bit like
Antibiotics.
Antibiotics, thank you.
Yeah.
Isn't that a little bit the same? Don't patients come in with an anticipation, if you're hurting, give me a pain pill. If I've got a sore throat, give me an antibiotic?
Well, to some extent. And it's certainly easier to prescribe the pill than it is to sit down and spend the time counseling the patient for 10 to 15 minutes. And so that is definitely one of the problems. But I think we have to be careful of blaming the patient. And for example, with the antibiotics, yes, patients do demand it, but nursing home patients don't. And the overprescription and unnecessary antibiotics in nursing homes is just as bad.
Is it really?
Yeah. Well over 50%. A lot of studies are 65, 70%. And so inappropriate use of antibiotics is a very difficult thing to try to correct, but it's something that squarely lands on the laps of the physicians. And the opioid epidemic, the information that they've been given about how to treat chronic pain, I do not believe is correct. I think that they need to go to a non-opioid type of approach.
I can't believe with this day and time, 2019, and all the things that we have figured out how to do, they haven't figured out how to make a product that relieves the pain without the negative effects of opioids.
Well, you know, in some respects they have. It's called non-steroidal anti-inflammatory agents. The results are the same long-term for chronic back pain or for chronic arthritic pain.
Is that right? Really?
Yeah. And that's what that meta-analysis in December showed that was published in JAMA.
And it doesn't, like the opioids, it doesn't become less and less effective the more you take it?
Correct. They are absolutely non-addicting, and aspirin or non-steroidal anti-inflammatory agents, if you have arthritis, decreases the inflammation. So it's not only treating the symptom, but it's actually many times improving the disease process. Now, that being said, if you're on these, they can also have some complications. You need to be monitored to make sure that you don't develop these, but even though they can have complications which are rarely serious, they are nowhere near the leading cause of death in people under the age of 50.
Good show, and I appreciate you being here. Is there a web address or phone number, anything you'd like to give for people that would like to have more information?
Well, just go to healthwatchusa.org. We will post a YouTube soundtrack of this show along with some references for people to look at.
Excellent. Thank you so much.
Thank you very much, sir.